First of all, congratulations to all the winners today for the Excalibur Awards. It's been an honor to witness those winners and all the hard work that they've done. For Capgemini specifically, it's been a real opportunity for us to join forces with the folks at TAG and the people here from a technology perspective, because from a business standpoint, we think there's a real opportunity for us to help folks in the state of Georgia and members of TAG, as well as in North America and worldwide, with our Office of the CFO offerings, because there's effectively been a convergence, especially around, as folks know, around technology, and as was mentioned today a couple times, is that the technology is able now, and around the Office of the CFO and what is required for the Office of the CFO with budgeting and planning and consolidations and performance management, and then more recently with governance and compliance, and then now with the new requirements for visibility into the enterprise. It's been brought on, of course, even most recently by our economic situation. These aren't new requirements for the Office of the CFO, but technology has finally caught up with the need, if you will. So again, thanks for having us today. It's been a real joy to see these folks share their work and share their experiences, and then it's been a real joy to see them win. And then hopefully we can come back next year and give you some of our own stories and experiences.
And I think we'll see more and more of this. I think you'll see physicians demanding it, hospitals demanding it, and we'll demand it. Because at the end of the day, when you're sick, you need a healthcare coach. And using technology to support this critical population will really reduce cost and assure better outcomes. Now, we also have technology-based programs for patients who are just diagnosed for diabetes, just diagnosed with asthma, congestive heart failure, that you can actually go online and be connected with a care team and be given tools to support chronic disease management. And for the 40% like us, we are starting to see a tremendous change in using technology to promote consumerism in healthcare. As I mentioned earlier, you can pay your bill online. You can get your results online. And we're looking at using technology to make the healthcare service experience, getting an appointment, easier and simpler for all of us. As a matter of fact, we actually believe it will take the mainstream technology players to help drive this onto our desktop. Several months ago, McKesson actually formed a strategic relationship with Microsoft to build a personal health record and a personal health system to allow us to manage our care. And a big part of that system is a concept that we've actually developed and patented down the road, and it's a concept of electronic visits. So imagine this: you have diabetes, you're not doing exactly how you thought you'd be doing, glucose isn't exactly where it should be, and instead of getting up from your office and going to the physician office, you go online and you conduct an e-visit. Today there are 13 payers that actually reimburse for electronic visits online, and if you talk to some of the leading academic medical centers, they'll tell you about 40% of the time people go to the doctor today, from a follow-up perspective, they could complete those visits online. So when I look at my sons, I believe their healthcare interaction will be very different. And a significant portion of the clinical exchange they have with their care team will be done with the use of technology. And that's the world that I believe we will create. You know, over the last year, I've had the opportunity not only to travel extensively in the United States, but we actually did a world summit where a group of us went to China, India, and several countries in Europe. And we asked the question, as we build this technology in the United States, What is reusable, and what could we build with the intent of having not only an impact in this country, but a global impact? And what an amazing trip. At the trip I learned there are 1 billion people in India who will never see a doctor or nurse in their entire life. 1 billion people. Now, if we get this e-visit technology down so you can e-visit a doc, wouldn't it be great if we could provide an e-visit infrastructure? Maybe just 100 million of those people get to ask a question or get an antibiotic that saves a life. But I will tell you, without technology, we can't have a big impact there because there won't be enough doctors and there won't be enough nurses. So when we look at e-visits, we say e-visits can have a dramatic impact in the US. But if we design them the right way, they could have a dramatic impact on care across the world. In China, at one of the largest healthcare organizations, at midnight, it's like a rock concert. They have yellow lines, and people line up. They don't do appointments in China. You want to go to a doctor at one of these prestigious clinics, you line up. When 7,000 people are in line, every night, starting at midnight, they stop letting people line up. 7 o'clock in the morning, the lines start processing and people are seen by physicians. There has to be a better way to organize the healthcare system. When those sick patients come back 2 weeks later and line up at midnight and go through the same process again, guess what? They see a different doctor who may or may not have access to a clinical record. There has got to be a better way. So when I look at technology, and I look at technology and the impact that we can have, I think we have a tremendous opportunity to change the healthcare system, and I think we have a tremendous opportunity to impact healthcare across the country. And when I talk to our team and when I talk to our customers, I say, you know what, not only do we have an opportunity, but I think we have a responsibility to make it happen and to make it happen quickly. So we all take to our jobs and to our work this opportunity to use technology. I guess I would leave you with a thought. If as technology leaders we don't set lofty goals, if we don't set out with big problems to attack, no one else is going to get there to fix them. We really can have an impact, and that's the best part of our role. Thank you. Okay, and we do have a couple of minutes for an open mic if anybody has any questions, except Gavin, no questions. Yes, sir.
Contrast the two presidential candidates' healthcare plans.
Yeah. First time I've heard this question. You know, in terms of the two presidential healthcare candidates, obviously Obama is pushing a plan that will have a lot more government intervention and government participation and government planning, whereas McCain is trying to focus more on freeing up dollars for healthcare and letting the U.S. system help people buy affordable healthcare. You know, I think from a healthcare technology perspective, either plan will require more technology to successfully implement. I have a bias on this. I think people who are setting healthcare policy, unfortunately, don't really understand the complexity of managing the healthcare process. And you know, I think we're at a point now where we have to do something around the 41 billion people that are indigent and going to the hospitals and collapsing the financial security of these local healthcare institutions. And, you know, I think either framework could potentially work, but without a lot of community health involvement and a lot of expertise in applying dollars locally, we could throw a whole lot of money at a problem and not make it better. You know, I think there's never been a more important time for people in Georgia to be involved in Georgia healthcare delivery. Whoever is elected is not going to fix this problem. It's a national problem, but it's very different state by state. So one plan will provide more federal programs, more federal structure. The other plan will provide more opportunity for choice and hopefully free up dollars. We have just got to get to a point that we give the healthcare organizations that are out there the ability to manage their money. I mean, when you think about it, people get paid based on how many people come in and have surgery or how many people come in and get sick. I talked to you about some of the programs that we have around prevention and chronic disease management. No one pays for those. So we really need to not only come up with a plan, we need to come up with what are we going to pay for in this country and what do we expect healthcare dollars to do in terms of improving the local community. Other questions? One over there.
Hi, thank you very much. The question I have is, over the last, I don't know, 6 or 8 years, I've probably had 4 credit card numbers stolen and used, and I'm pretty careful with my credit cards and online transactions. As we go to a paperless society, how do we secure our medical records, which potentially could be much more damaging to us if they get in the wrong hands?
Yeah, it's a great question, and you'll probably be surprised I have a strong bias on this one. I'm going to tell you a story. There is something in healthcare called HIPAA, which is an extra level of security and compliance around all healthcare data. And one of Robert's big jobs is making sure all the McKesson data centers and processes are HIPAA compliant so we can track everyone who's looked at a record and provide additional security to make sure only the right people see their records or the right physicians see the records of patients. And so we've added a lot of complexity to the management of online data. And you know, we can't say there's never going to be a breach. That's just not realistic in our world. But we can say that there are federal, state, and local efforts to keep data secure and to keep organizations that deal with healthcare data compliant. I think this is a really huge issue that we have in healthcare. And the example I was going to give you is at McKesson, right down here in Druid Hills, we process the Medicare Part D program. And for those of you who follow Medicare, about a year ago, Medicare gave an additional script benefit to seniors to make it easier for senior citizens to get prescriptions. And they get them at a much reduced fee. As a matter of fact, the government pays for a significant portion excuse me, of the expense. So we actually know every senior in the country and what drugs they've taken. Now, we can't look at the data. We have no data rights for the data. It's CMS who runs the data, and it is a very secure data center and with a lot of these requirements. And we've put all of these additional authentication guidelines around entering the center and everything else. So it's very well protected. One could argue the data is more protected the way that we have it than if it was in paper files somewhere. Now, I've gone to Washington. I go every 3 months, and I ask the government to give this data to senior citizens. So if a senior goes to the emergency room, the people who treat that senior in the emergency room can go online and see what drugs they're on. Okay, let's face it, we all get mixed up. We don't remember. If you're on 5 or 6 drugs, your chances of being in an emergency situation and being able to communicate what you are very, very low. The government won't release the information because there are too many concerns about security. And would the right person in the emergency room get the data? How would we know? So we are going to work through this, and at some point, I can't tell you if it's 2 quarters from now or 10 years from now, that data will be released. But one of the things that we've got to do is we've got to make sure that these security systems don't paralyze us and keep us from making the data that we need to make the healthcare system safer available. So real important to keep the data safe and confidential, but also really important to make sure that when a care provider needs the data, we have the information. Other questions?
Because data is so available today, one of the questions that I've always had is, how in the world can we connect things in a way that a consumer can understand? If you look at today's society here in the US, and you hear all the figures about weight gain, you hear all the figures about heart disease, diabetes, and you start to do some research, what you find is some of these things fit together. How many people in this room know enough about their own nutrition to figure out that they may be killing themselves slowly, whether you like it or not? How do we get this data connected up with the medical data so that when the professionals treat me, they can hand me off to somebody that can help me understand that, whoops, this set of eggs I ate here this morning shouldn't have been eaten by me. The rest of you could have eaten them, that's okay.
Right.
Do you have anything in that area?
It's a great question. We started a consumer and patient division about 2 years ago. And like everything in healthcare, it takes a long time to get broad-scale adoption. We have about 2 million patients today that use our systems, and we've learned a lot watching the systems roll out. So I'll share with you some of our initial learnings. I think you hit the nail on the head that people aren't going to manage their record if it's empty, and they have to populate it themselves. And so what we've decided is populating it with a patient's medications so they can manage their medications and stay compliant, populating with a patient's results so they can see, do you have high blood pressure and how are you going to monitor it, and populating it with critical data and goals is really essential to doing it. Now, once we've done that and you can hook that up to a nutrition site, I think people will begin to adopt, but it will be the real technology savvy people who also value online healthcare support. So I think that model will evolve. I think my kids will use that model because they do just about everything, including ask girls out online. So why wouldn't they, why wouldn't they manage their own health and fitness? Now, to accelerate adoption of this type of technology, what we believe is you actually need a coach to email you and keep you interested, just like you might have a personal trainer or something, and to get you in a life routine where there's value coming back to you from using that data. And so our model says you can use just the technology or you can use the technology in a coach. Today, the coach is actually a person. It's a person. We have 1,200 nurses and call centers who can get online and talk back with you if you buy the service. I think over time, that coach will be more like a GPS. I think the technology will get sophisticated enough that you'll be able to enter in what you want, and the system will be able to prompt you through with less and less clinical intervention. So, for a long time, I've been in healthcare technology for 25 years. For a long time, the technology held us back. You know what you wanted to do, but it was too slow, or you had to take it down for 3 hours every night, or the computer cost $2 million if you wanted to do that. The tide has flipped, and now the technology is ahead of where we are as human beings and how we value technology in supporting the healthcare process. So I think we just have to figure out process-wise how to make that connection. Okay. All right, thank you. Thank you very much.